Good afternoon, and thanks everybody for being here today. As you know, the demand for heating fuel has increased significantly with the extremely cold temperatures we are currently facing. Earlier this week, we announced an improvement to the Energy Crisis Intervention Program for low-income Missourians. When a household's energy source has been shut off or at risk of disconnection, this program pays the minimum amount needed on the fuel bill to get the household out of a crisis. Starting this winter, the program will now pledge the maximum disconnect amount up to $800 toward the owed balance. This will make it faster and easier to resolve a household's crisis situation and ensure we keep Missourians safe and healthy, especially during this extreme weather. Recently, we have had numerous people reach out about huge price increases in natural gas. Given the extremely cold temperatures, I understand there have been some supply issues. However, we will not tolerate any effort to price gouge or take advantage of customers at a time when there is no other choice or alternative options. We have reached out to the Attorney General's office to look into this matter, and we will use all resources possible to stop any kind of illegal behavior. We ask any Missourian who believes they have been subject to price gouging to contact the Attorney General's Consumer Protection Hotline at 1-800-392-8222. On the COVID-19 front, we are happy to report that the coronavirus activity in Missouri has declined for the 5th consecutive week. Since the very beginning, we have taken a balanced approach, and the data shows we are doing the right thing. Missouri is now 4th lowest in the nation for average daily cases. Only 7-day positivity rate is down to 7%, and our 7-day average for new cases is approximately 533 cases per day, a number we have not seen since June. Since a peak of more than 7,600 new cases reported on November the 9th, newly daily case volume has fallen nearly 95% to 448 new cases on February the 12th. Over the past 14 days alone, recent reporting from the New York Times shows that these new case volumes has fallen by 42% and hospitalization by 22%. Missouri has come a long way over the past year, and these numbers speak for themselves. Each and every day, Missourians continue to step up and do what is necessary to protect themselves and their loved ones, and we are so thankful for that. We also continue to see great progress with vaccines. Approximately 86% of vaccines received by Missouri providers have been reported as administered, not including those through the federal pharmacy partnerships with CVS and Walgreens. Including vaccines shipped to CVS and Walgreens, nearly 80% of vaccines allocated to Missouri have been administered. This exceeds the federal government's benchmark, putting Missouri in a better position for future vaccine allocations. Ensuring fair and equitable distribution of the COVID-19 vaccine has been a top priority of our plan since it was originally developed back in October. We have worked extremely hard to make sure our communities are receiving allocations that reflect the populations they serve, and we have been successful in doing so. Last week, We address concerns and false information regarding vaccine allocations to the St. Louis region. Again, I want to emphasize that the region is receiving allocations that are proportional to its population. Of the 898,175 doses by Missouri providers, Region C, which is the St. Louis region, has received 315,200 doses, or 35% of these doses as of today. This does not include doses to the federal partners. Broken down even further, the St. Louis metro area, which includes Jefferson County, St. Charles County, St. Louis County, and St. Louis City, representing approximately 31% of Missouri's population, has received 282,300 doses, or 31.4% of the state's total allocation. Region C and the St. Louis metropolitan area especially is receiving and will continue to receive the number of doses it should be. To date, Missouri vaccinators have administered approximately 940,000 total doses across the state, and we are confident that we will reach the 1 million mark by the end of this week. Nearly 667,000, or 11% of Missourians, have received their first dose. While this may seem like slow progress to some, this is quite an accomplishment given the supply is still extremely limited. Once supply will consistently allow, Missouri vaccinators will have demonstrated the capacity to administer nearly 50,000 vaccines per day. We also continue to move forward with our regional mass vaccination events across the state. This week's events were canceled through Friday due to the weather, but we are working to reschedule these as quickly as possible. I want to be clear that this did not impact regional allocations. Shipments for next week's events are being redistributed to community hospitals within each of the 9 regions. So far, our mass vaccination teams have completed 27 initial vaccine clinics across the state. Our targeted vaccination teams also completed their first round of vaccination events last weekend. These 4-man teams administered over 2,000 doses in Kansas City and St. Louis at these first events alone and have continued their operations this week despite the extreme weather. Yesterday, one of the St. Louis teams worked with the Urban League of St. Louis to complete another successful event in a community with limited vaccine access. This type of collaboration is crucial and will only continue as more targeted vaccination events are scheduled. Recently, common questions has been raised about who is eligible to be vaccinated in the state of Missouri. On Monday, we released additional guidance for Missouri vaccinators regarding the residency status of those seeking COVID-19 vaccine in the state. With many of our metropolitan areas located near state borders, it is common for Missouri and non-Missourians to regularly cross state lines. With that said, state allocations are determined based on population, so it is important that we use our limited supply each week to vaccinate and protect Missouri residents. Just as other states are prioritizing their own citizens, Missouri's vaccine plan prioritizes the vaccination of Missouri residents first. Vaccinators should either use the state screening form or a similar process asking individuals to verify their residency and status in a prioritized population. With the current active phases of our vaccine plan, approximately 3 million Missourians are eligible to receive the vaccine. That's nearly half of our entire state. Regardless of any other criteria, if they fall in Phase 1A, Phase 1B, Tier 1 and 2, they are eligible to receive the vaccine. From the very beginning, COVID-19, we have prioritized our most vulnerable citizens, and we will continue to do so. As supply continues to increase, more and more Missourians will have an opportunity to receive a vaccine. But it is important to remain patient and understand that demand for vaccine will still far outweigh the supply for some time. Speaking of supply, we continue to see steady increases in our weekly allocations from the federal government. On top of our state allocation, the federal government is also allocating additional doses directly to Walmart and Health Mart pharmacies and federally qualified health centers. Additionally, the FDA recently released updated guidance stating that each vial of Pfizer vaccine contains up to 6 doses rather than 5. This means that each shipment from the federal government will now be reflected as 1,170 doses instead of the 975. While every increase in supply helps, this still remains the number one limiting factor. I was on the phone last night with governors all across the United States, Democrat and Republicans. The problems we see in Missouri are the same problems every state governor is facing, regardless whether they're from a red state or a blue state. The problem with the limited supply continues to be a barrier of getting more vaccine in people's arms. We're working hard every day to get vaccines out as quickly as possible. But like I said earlier, there are approximately 3 million Missourians currently eligible. The quicker we can vaccinate those in our activated phases, the sooner we can activate the next tier. I assure you that we will give every Missourian who wants a vaccine the opportunity to get one. Thank you. God bless. Dr. Williams?
I would just like to add my appreciation and thank you to the governor's comments. When I woke up this morning, we were no longer 5th in the country, we were 4th in the country for the fewest cases per 100,000 over the last 7 days. And as the governor said, that is a trend that's been going on now for several months. And so just a testament again to many people. There's an old saying, the sum is greater than the parts. We've been on phone calls today with clergy and mayors and county commissioners and just a lot of people coming together to make that happen. And those numbers are reflected in our R0, which is now less than 1. And as you know, with an R0 less than 1, it is the trajectory of viruses to burn themselves out. At the same time, our positivity rates are low, our hospitalizations are low. So all those numbers are a testament to a lot of hard work by a lot of people. And basically, at the end of the day, the people of Missouri who've greatly contributed to that by doing what we've asked them to do. So just my thanks for that. A couple of other things. One, some new studies coming out showing that transmission rates are probably related to viral load. And so when you look at what we call breakthrough cases where you get a vaccine and yet you're one of the 20 people who still gets COVID, those people appear to be much less infectious. So the reason I'm telling you that from a clinical perspective is that it reinforces this idea that at the end of the day, like some other infectious diseases we see where we look at viral load, that it is the viral load you're carrying around in your nose that probably determines whether you give it to one of your loved ones. And how do you decrease your viral load? Is you decrease it by decreasing your exposure. So there probably is a fundamental difference between somebody with full-blown COVID coughing in your face and you picking up a pen which would be unusual, and a very, very decreased viral load at getting infectious. And that would be not the way it's usually transmitted. So it just reinforces more and more this idea that the reason social distancing and hand washing and wearing masks if you can't social distance are working, because it all kind of comes down to you're decreasing your viral load. So, Kelly, glad to answer any questions that I can.
Hi. A lot of our neighboring states, including Kansas, have started to prioritize teachers for vaccination to speed up back-to-school process. Are you all considering moving teachers up in the vaccination priorities?
You know, I think as the governor said, our North Star is our most vulnerable, and I think I've told you the second thing I look at every morning after I look at the case rate is the percentage of our senior citizens who've been vaccinated. So this morning for 85 and over, it was 35%. For 75 and over, I think it was 24%. And for 65, it was 25%. And so if you add in the universe of 1 million Missourians who have heart disease and type 2 diabetes and cancer, those people who are more likely to get sick and bluntly to pass away if they get COVID continues to be the governor's focus and my focus and all of ours focus. It's the biology of the disease. If you have two people, a teacher and a 70-year-old with diabetes and a 35-year-old teacher, and you could put in anybody else in there. Don't just pick teachers, pick other people who work in food, working and all. We just feel it's our obligation to protect those who are most likely to get really sick. So the answer is that's what's guiding us and will continue to guide us.
Hey, Dr. Williams.
Hey, Emily.
Just a quick question. A few weeks ago, you said you were going to get some advice or some guidance on the second dose. If people didn't take their second dose, how long they could actually wait until it wasn't good anymore?
Yeah.
And then what was the state going to do with that second dose?
Yeah.
Can you talk about the guidance you received?
Yeah, well, again, they did put out guidance. 6 weeks is what they recommend for that second dose after you were supposed to get it. They still don't recommend that you start over, but they extended that window to 6 weeks based on what they were seeing. And have still not gotten the guidance is that if you don't come in, at how quickly you can use that second dose. And if you use that second dose from a logistical standpoint, should you hold half back, because that would then be a first dose with no guarantee of getting a second dose. So should you hold half that back? And I'd hope to get that this week. It's Thursday. In a conversation with the White House 10 days ago and have not heard yet. So thank you for following up on that. But the short answer is have not heard from the White House yet or HHS.
Do you have any more information on how exactly the doses that were supposed to be given out this week during those max vaccination sites will be given out?
Yeah, well, first of all, we transitioned those over to we did not want to lose any effort. So we've moved, as the governor just said, we've moved those over to other hospitals and things like that in those regions. And so we just didn't want to lose any speed on that. So, and I think that's worked out well.
So those won't be rescheduled?
Yeah, and I want to give a shout out to Patrick and our Department of Transportation. They've just done a phenomenal job on the roads, and obviously whether it's coming from Memphis or wherever, the vaccine has to get from Michigan through Memphis and FedEx and UPS, and Patrick's done a great job. Robert Nodell and I had the opportunity to be in Kansas City tomorrow and yesterday and work with Charlie Shields and at Truman and see the vaccination efforts there. We think it's just incredibly important for us to get out and say thank you, and just couldn't thank the people there at Kansas City yesterday. And the only reason we were able to get there is that the roads were so good. 70 was so good. So I want to give out a shout out from the public health community to Patrick for making that possible.
I have another one for you, but we're going to focus on the weather, as you just mentioned. Earlier this week in the planning vaccination meeting that Lisa has every week, Adam mentioned that there is a delay this week due to winter weather with the shipments. Any idea how long they're delayed, and is it going to affect the state and what our providers are receiving from the state? When are we expected to get those shipments?
Yeah, Emily, I'll follow up with Adam, but my sense is that they're coming in. You know, the roads are getting better because of the sunlight, even though it's still real cold. that is melting the snow. So I'll need to get back with you on the exact date of those distributions. But we're in a much better situation today than we were on Monday, I can tell you that. Thank you, Kelly.
Hi, Governor. Excuse me. So kind of going back to what you started with at the beginning with the natural gas prices, some cities and communities have had to pay just extraordinary prices for frozen gas. Fulton in particular, they had to pay $3 million in 4 days. Is there any talk about state relief or federal relief in an emergency for these communities?
Yeah, I think we have those options out there to help those communities. But first of all, you got to figure out what that source was. For somebody that used to be in the gas and oil business, I don't want people to be taken advantage of just because we're finding a way to pay some corporation money that's making millions and millions of dollars off of a national or a natural disaster. I want to make sure that's not happening. But we're capable of helping communities and helping people through some of the programs we do. But again, I think every state, and I think other governors are going to be looking at the same thing. We want to make sure what is the cause of this and who's benefiting from this. I realize shortages of whether it's fuel, whether it's natural gas, whatever it might be, but I don't want anybody taking advantage of that either. Because we've only been in this for a few days and all of a sudden prices are skyrocketing before you've even eliminated the storage capacity of a lot of these companies. It's frustrating. I'll just say that. And I can't imagine what it's going to be like for sticker shock when a lot of people get their bills. It's going to be a tough environment. So that's why we've been in contact with the attorney generals, and I want to get that started as soon as I can to protect the people. But we do have resources. We'll just have to see how that plays out.
Definitely. And are you working with the federal government at all to, with any kind of state of emergency or anything? Because, of course, this is a huge issue across the country. So any works with that? Yeah,
I think, again, that conversation come up this week on a couple of calls I've had on the national level with the governors across the state. Again, the National Governors Association, which is made up of Republicans and Democrat governors, but I think we're all facing that issue. And then seeing what the declaring a disaster emergency order might look like and what does it really do and how does it help with what resources we have. But I think to answer your question in general, we do have the ability to help in some situations, especially for individuals like we are. I'm not sure what's going to come down to cities and counties and when you start trying to backfill that loss. I don't know. And I don't know what their contracts are with these companies either.
So during the pandemic, you've basically said we're not going to do a statewide order. We're going to let locals handle this. Do you feel like the local governments have handled it well? Because you're seeing some arguments on the third floor that they overstepped their bounds.
Yeah, I think you can see that. Look, we've been in a pandemic for 11 months. I don't think there's any question sometimes that on the local levels they stepped over their bounds in different areas. I think the issue that came up a while ago when you're talking about kids being in school, I think that's been pretty plain from the beginning, no matter who you're affiliated with, that the safest place for kids to be in was in school. And for the vast majority of Missourians, kids have been in school. 83% of them, I think, are sitting in a classroom. And I think you get into those issues where people do mandates on things like that. That's why I think you got to be very careful to do it in that. So, yeah, I do think there's times when healthcare officials in different parts of the state have probably overstepped their bounds. But I will also say this, because I want to make sure there's both sides of this. The vast, vast majority of them has done a great job in some of the most difficult situations you've been in. To second guess anyone in the middle of a crisis when you're trying to help people is a tough scenario to go through until you've actually been through it. At some point, we're all going to be able to look back, and I think there will be real analysts to see what really did happen, what really did work. But until then, I think we're just assuming a lot of things till we actually have facts to see, was it better to take certain routes above others? And I think we'll all be open to that.
Have you been in talks with either the House or the Senate about placing limits on the local health officials or local officials? I
have not. I mean, I know those discussions are taking place, but, you know, normally as a rule, we're not too active early on in the session part. I mean, there's a lot of things, moving parts of that by the time it goes to committee hearings, by the time amendments are put on it, and then you get through the Senate. So we're a long way from probably us looking to see at what engagement we would have. The biggest thing we look at early in the session is the legality of stuff. I mean, I think for my crew, we're always looking to say, hey, is this even possible to do if it comes? So I think we look more on the official side. Is this legal, even whether we agree with it or not? Is it possible to do? And if not, that probably raises more of a red flag to us to go back and say, hey, look, I get what you're trying to do, but that probably won't work.
I'm going to ask you a vaccine question. You said last month to me that you were going to wait to possibly till the middle of February to get your vaccine. It's the middle of February, Governor. What's your answer? Are you on a wait list? Have you done anything at all?
Are you really worried about my health is what I want to know on that. Okay, all right. Then I'm going to answer that question if it was really out of concern on that. I have taken my first vaccine. I took it actually last week. Me and the First Lady did here in Cole County. We put ourselves on a list like everyone else. We got called up. We went down to the center. And I must say, now going through it personally, they did an outstanding job here. The people there that was administered. There was other people there that was having the shot. Everybody was in extremely good mood, I will say that. And so it was pretty good for me to go out there and get it, although I don't like getting a shot that well. But the environment that they presented out there, that people were doing the right thing, stepping up. So, yes, I've had my first dose. As far as me and the First Lady went, we were fine. It was Pfizer that we used. We had no effects whatsoever. A little bit of a sore arm, but other than that, we can tough that out. Thanks for asking about my health, though. I appreciate that.
Are there any concerns with possibly getting behind with the state's vaccine distribution plan now that those mass vaccination clinics with the National Guard are being pushed back?
No, I think in our strategic plan, I want to give Colonel Cole a little bit of a shout out on the National Guard for planning. We actually had contingencies put in there in case, because we were in the middle of winter, if we had to cancel, we had some makeup time in there at different days. So I don't see that. And the other thing, I think, the shipments may be a little late, but still the demand's there. So as long as we can keep getting that out, we can spread the vaccine out to more distribution centers if we need to, just like we did to smaller hospitals and smaller avenues. So I really think we're not going to miss very much at all as far as timing goes or vaccine in people's arms just because of the shortage of demand. But we're going to continue. If it means working 7 days a week to make up the time, I really want to hit these numbers because I think in the next couple of weeks we would be able to really have a plan in place when we could announce the next phase of what date and what time that would happen on that. Thanks, everybody, for being here today. Thank you.